I'm Mildred Solomon. I'm the president of the Hastings Center, and it's my enormous pleasure to welcome you to our Health Equity Summit, Righting the Wrongs, Tackling Health Inequities. I want to start by thanking David Skorton, the president of the Association of American Medical Colleges, and Ross McKinney, its chief scientific officer, for their support of our collaboration very early on. Many thanks also to the American Medical Association, the American Nurses Association, the American Board of Internal Medicine Foundation, and the American Hospital Association. All these organizations have helped to mount this event and serve as co-sponsors. We've had a terrific program committee, most of whom you will be meeting over the course of the 2 days as they moderate various sessions. Many thanks to our program committee. None of this would have been possible without the vision and great generosity of 2 of the Hastings Center's recent board members, who are now active members of our advisory council, Frank Trainer and Andy Adelson. Frank and Andy, thank you. Earlier this week, we celebrated Martin Luther King's leadership and his commitments to justice and to the equal moral worth of all people. From its earliest origins, bioethics has invoked those principles to analyze ethical issues arising in medicine, healthcare, and the life sciences. One of the most concerning ethical issues of our time are the disproportionate burdens of chronic illness and the shortened life expectancies of African Americans, Latinx members of our society, and Indigenous people. Our nation has known about these disparities for generations, but the pandemic has brought them into full and hopefully inescapable view, demanding action. At the Hastings Center, we believe that action should always be preceded and informed by understanding. That's why today's session, which is the first of a 2-day event, this first day will focus on coming to understand what has created such disparate health outcomes. Now, it's well documented that social, economic, and political factors determine health: housing, education, urban food deserts, the location of communities near toxic sites, chronic stress from living with discrimination, as well as many other structural determinants undermine the health of a population, and especially in our country, communities of color. But why are those determinants so unequal in the first place? In the summer of 2020, when we were a few months into the pandemic and a short time after the murder of George Floyd, some of us at the Hastings Center began a self-study effort. We read a number of books to help us understand racism and health inequities. I became personally shocked at how much American history I didn't know. As we read, we learned about Jim Crow and the Great Migration of millions of African Americans over a 55-year period in the 20th century who left the South for a better life in the North and West. And of course, that is the topic of Isabel Wilkerson's first book, and she is our first speaker this morning. We also read about the federal and state laws and policies that created residential segregation in the United States, the topic of Richard Rothstein's book, our second speaker. This history helped us to understand the reasons behind the unequal social determinants. And that's what we want to explore further today. The first 2 presenters will give us a window in on American history and American culture. And our third speaker, Professor David Williams, will connect the dots from this history to its consequences in health. So that's day 1. Day 2, tomorrow, moves from understanding the history to designing solutions. My colleague, Philip Alberti from the AAMC, will convene the session and introduce our keynote speaker, Daniel Dawes, the author of The Political Determinants of Health and a key architect of the Affordable Care Act. Then tomorrow, there will be a series of panels for healthcare executives, clinicians, and health policymakers, outlining approaches to redressing health inequities in 4 domains: policy, research, clinical care, and professional education of physicians and nurses. I hope that all of you will attend both days. Now it's my privilege to introduce Dr. Reed Tuckson, who also has words of welcome. I asked Dr. Tuckson to join me in launching this event because he was very influential in shaping my own thinking and validating the center's desire to mount this meeting. I spoke to him very early about the early concepts we had for this conference. Dr. Tuckson is an elected member of the National Academies of Science, Engineering, and Medicine, and he has served in several leadership roles within NASM. He's also the co-founder of the Black Coalition Against COVID, which assembled leaders from across the nation to provide science-based facts and information needed to drive COVID prevention measures and vaccine acceptance. Previously, he enjoyed a very long tenure as Executive Vice President and Chief of Medical Affairs for UnitedHealth Group. He was a Commissioner of Public Health for the District of Columbia during the height of the HIV/AIDS epidemic, and served as President of Charles R. Drew University of Medicine and Science. He's currently Managing Director of Tuckson Health Connections. Dr. Tuckson?
Well, thank you so much, Dr. Solomon, and all of your colleagues at the Hastings Center deserve great commendation for putting on this very important meeting. This is an important meeting and an important conversation that is occurring at just the right historical moment. It is important because of what's at stake: preventable premature death and the amelioration of misery and suffering for millions of human beings living in this country needs to be a matter of the highest priority and urgency. Our brothers and sisters are simply dying too often. Our agenda over the next 2 days is intentionally concerned and devoted to addressing the fundamentals of what should matter to any society that aspires to the ethics of a civilization, and certainly to one with the aspirations of a democracy. And what those are concerned with is whether or not all of the people who share our time and space shall have a fair chance to live the fullest of their lives and be free from preventable misery and suffering that impedes the full flowering of the person. Unfortunately, in the America of today, this aspiration, this fundamentally civilizing ethic is not realized, has not been made manifest. Just as it wasn't 400 years ago, when a period of 250 years of enslavement of my ancestors began. It wasn't realized 150 years ago as my ancestors' longevity and health were compromised by the obscene realities of Jim Crow. It wasn't realized 90 years ago when poor sharecroppers in Tuskegee, Alabama were enrolled in a US government study whose primary characteristic was denial of treatment for the syphilis that plagued them. It isn't realized today when thousands of people are compelled to take to the streets and shout out loud in a primal scream that my life matters. As I conclude, the issue squarely before us is this: how, in the midst of this tumultuous moment of a divisive, polarized, tribalistic, and angry nation, how do we understand the path and the forces that delivered us to this morally and ethically unacceptable moment in our human history? How do we understand so that we can make a change, take a detour, finally clear a new path? When I was the Commissioner of Public Health for DC, as mentioned by you, Millie, I learned that health is the place where all the social forces converge to express themselves with the greatest clarity and the most important. Let us come away from these 2 days understanding those social forces, their roots, and the mechanisms that sustain them, such that they might be re-engineered to serve the purposes consistent with the sanctity of all life, the celebration of the dignity and worthiness of all people, the ushering in of the full realization of a dream of a truly democratic civilization. Thank you, and back to you, Dr. Solomon.
Thank you, Reed. That was very moving. I have to take a breath. Thank you.